The non-infectious diseases of the small intestine and protein-losing enteropathy in dogs and cats. The diseases are acute hemorrhagic diarrhea syndrome, chronic enteropathies, and protein-losing enteropathies. The chronic enteropathies are food-responsive enteropathies, antibiotic-responsive enteropathies, and immunosuppressive-responsive enteropathies, and non-responsive enteropathies. And the protein-losing enteropathies are lymphectasia, IBD, neoplasia, and hemorrhages. For acute hemorrhagic diarrhea syndrome, the causes are Clostridium pharyngeales overgrowth, stress, and toxins. The signs are acute vomiting, bloody diarrhea, hypovolemia, and shock. The treatment is IV fluids, antibiotics, antiemetics, and an intestinal diet. For the chronic enteropathies, for food-responsive enteropathy, it can be caused by allergens such as beef, wheat, and chicken, and it's managed with hypoallergenic diets. In antibiotic-responsive enteropathy, antibiotics can cause dysbiosis, and it's treated with metronidazole and a good diet. In immunosuppressant responsive enteropathy, here we have lymphocytic plasmacytic or eosinophilic enteritis, and it's treated with prednisolone and cyclosporin. In non-responsive enteropathy, this is a chronic enteropathy that does not respond to treatments. It's managed with probiotics and fecal transplants. For protein-losing enteropathy, this is when proteins are lost in the GI tract. The causes are primary and secondary. In primary, it's lymphectasia, and in secondary, it's IBD, neoplasia, and hemorrhages. The signs are chronic diarrhea, ascites, weight loss, and edema, and the treatment is ultra-low-fat diets, corticosteroids, and diuretics, such as prednisolone and furosemide. In the case of intestinal neoplasia, the types are: in cats, it's elementary lymphoma, and in dogs, it's adenocarcinoma and lymphosarcoma. The signs are chronic diarrhea, vomiting, and weight loss, and the treatment is surgery and chemotherapy. For diagnosing the non-infectious diseases of the small intestine, we can do tests. In the lab, we can look at hypoproteinemia and hypocholesterolemia. For imaging, we can look at mucosal thickening, and for biopsy, we can confirm the diagnosis. They can be treated by giving a hypoallergenic diet and an elimination diet, prednisolone, cyclosporin, and metronidazole, and fluids, antiemetics, and nutritional care.